tape you, but I didn't have time to tape you
Tape
before
me,
the
right.
test, okay? Because you're all smiling. You weren't, okay?
No,
Trust
I
me.
wasn't.
Okay,
Yeah,
and
I
you
was-
were gray when you came in here. You have color now. Does she have color?
Exactly. All
Yeah.
natural
You
and
said my
relaxed.
eyes now look a little bit.
When you
Yes.
say you got a look.
Yeah. And
So how does your line look now compared to before the treatment?
Well, she has a sparkle in her eye. And now I noticed too, she's sitting up straighter. Before she was like I was when I came in. I was like down here.
Yeah.
It was
and
terrible.
the back in her eye and the darkness in her
Yeah.
the eye was better.
Yeah, the
Now
puffiness
it's
is
better.
gone.
Puffiness is
About
gone.
90% gone, puffy.
Well, tell us about her story. She refused to come since April.
Well, because
April?
well, before I had pneumonia,
Yeah.
but I did. You did. I don't know if you told me about it. No, she didn't.
No,
say.
because she was already with her doctor and
Yeah.
getting fixed up and
Yeah.
everything, and had already been off of work, and then the shingles hit. And I said, oh my.
I thought it was a burr. I mean, a muscle. Next morning, I wake up and it's all red with blisters.
And she
But I
tells me
just
she had a
mentioned
burn.
I just mentioned to my husband that he didn't see it. He was a medic, and he would have known. And I told her about it, and I told her what I did that I thought I did. And then the doctor called and he goes, "How I was doing?" I told him what I did, but then the next 2 days it was spreading, and my husband saw it. And
Was
he
it
goes,
painful?
Yes. He
Okay.
had given me Vicodin.
Vicodin.
And I couldn't go to work with the Vicodin. I would Advil, strong Advil or Tylenol, but I couldn't even finish my shift. I was so much pain, and my husband saw it, and he said, no, that's something else. He says that's not a burn.
So how long were you able to work before you became disabled?
Oh shoot, just like 2 days. I
So
dealt
after-
with it. It hurt. It
Oh.
hurt. But I was on like Tylenol or Advil. But like I said, I couldn't finish a 4-hour at work. I couldn't finish 4 hours.
Shingles
It was
was very painful.
and
yeah.
very painful. So my husband said, he knew it was something else, and she had told me it was shingles. I go, what shingles?
Mhm.
And she said, Elsie, the way you're in pain all the time.
Yeah, she's a nurse.
Yeah, so
that's right, yeah.
and I believe that.
I didn't say shingles. I couldn't think of the word
no.
shingles.
I said shingles, and you
Yeah,
said
I said herpes zoster.
yes.
Every sausage, even
And
better.
I couldn't remember the
Yeah.
the common
It doesn't
name.
matter
She
what the
did.
name is,
But what
okay?
the name was.
And she
but-
said, I don't, and then her husband said, you have herpes?
And he
I
got
said,
it.
no, no,
not that type of herpes.
Not that
Yeah.
kind of herpes. But anyway,
But-
then I realized what the word shingles is the common name for it. So,
She took me
took her to
to the
the doctor because she wouldn't come here.
Oh, so
And-
you asked her to come here?
Yeah.
first, but I just
Yeah.
said, how can I have so much pain? I just.
And then when he gave
and
her Vicodin, I just like, oh no, my God.
It just masked the pain. It was, I didn't have
And
any pain.
I did say to you, it's
Yeah.
only gonna cover the pain,
Cover the
it's not
pain.
gonna cure you.
She has experience.
Oh yeah, she
Yeah.
knew what she was talking about.
So since April until now, what did they do for you?
just drugs.
Okay, who else have you gone to? What else have you tried besides drugs?
No, just the doctor. Just my
Just
How many doctors?
primary doctor.
Oh,
Just my primary.
and a lot of drugs.
Yes, and that's why I think I was shaking. And he
Yes.
said it because of all the medication I was on.
And Elsie's not used to taking drugs,
I
medication.
do not like pills. I could never be an addict or a pill.
Okay, so how did you feel today before the treatment?
Very nervous,
yeah.
nervous, very anxious, and just wanted to get it over with. And
What were
I
you
just
nervous about?
about needles. Yes,
About
I have
needles.
this fear of needles. I had
Yeah.
a bad experience when I was very small with the dentist, and I remember him yelling at me, and I was almost crying. And ever since then, you'd think I would get used to needles. I had 2 children. You get a lot of shots. I had breast cancer, and you think I would get, and no. And then coming here, I just wanted to get it done, and
She didn't want to come.
but I said no. I'm gonna do it. I need to get. I just want to be out of pain. From the
So when
shingles.
she was waiting for me, treating the next patient, how was you acting?
Oh, yeah, very interesting. She was
I was pacing.
pacing, and she was pacing, and she was doing this, and there was she was in constant motion, and then
She was,
Yeah.
she got this.
Yeah, Yeah.
Parkinson's, you know,
Yeah, it's
tremor.
just about,
It doesn't
yeah.
matter what you call it.
Call
okay?
it, yeah,
you're,
it is from that,
you're
you
very,
know.
you don't look like this, you don't talk like this. Yeah.
No, it was,
So how
I'm
do you
so
feel
glad
now?
I came, I'm so glad. Very relaxed.
Very relaxed.
You know?
You're
Well,
still
she
afraid of
would-
needles?
Well, I don't, hopefully not, I mean.
No, I mean, how you compare to before? You're still afraid of needles so
Oh,
much?
not like last time, no, not like,
And it's only
before. Yeah.
25 minutes of treatment.
That's it.
Change you
Yeah.
totally.
And then those 2 needles that you gave me,
Yeah.
and that was nothing.
Or nothing,
You know?
I see.
No,
The acupuncture.
no, the acupuncture, excuse me,
Right.
yes, yeah.
So you will come back next week without any fear?
Hopefully not, you know, I think
But
I
right
can.
now, do you feel any anxiety about having an eye treatment?
No, I don't think so. No,
See?
yeah.
I told you.
Yeah, yeah.
How's your breathing? You had chest pain here before.
Yeah, before, it would come and go, but
But is the breathing any different?
I think it's deeper. I think
Deeper, right?
Deeper, yes, I think
Easier.
you're right, you're
Yeah.
right
Mhm.
there. I
Yeah.
thought I could, but not
Now you
as
can
I
see.
could, yeah,
Yeah.
yeah.
Mhm.
But don't you
Yeah.
think so, Dr. Tong, and please correct me if I'm wrong, but with the breathing, when you don't have the deepness of the breath and it's more shallow, you're into the stress where it's constricting all of your
Yeah.
muscles and nerves
It's all stress.
and this, when
Yeah,
you
it is.
do
And
the
I do have a lot of
injections,
stress.
released it,
Yeah.
it released it.
Very good. You learned the lesson really well.
Yeah.
Okay, let's
And-
talk about what caused all the blocks in the first place. Okay, you have a dog that
I had
when
a
you-
dog, yeah,
12
that I
years
lost.
that died a year
Yeah,
ago.
and I thought I could handle losing, you know, I even went to work that morning, we had to put him down.
Oh.
I thought, okay, I can handle this, you know, we'll just, I had to kind of
Yeah,
psych
you
myself.
can handle it.
And Karen took me and I just, you know, I fell apart. I
What
just
other
could not-
stress besides that?
And then I have stress, my mother lives with us.
Oh.
And I'm supporting,
You don't have to say much about that.
Oh, just- okay.
Depends on which
No,
kind of
go ahead,
mother.
no.
yeah,
no.
so
Yeah.
I.
Everybody can understand that.
Understand, so.
But you're
I'm
supporting
trying-
her for
Yeah, I'm supporting her
years.
10 years, and so I've now asked her, since I wasn't working, that she has to,
Okay,
Give to the
let
family.
me explain what the stress does.
What?
Stress blocks those antennas.
Antennas.
Those are meridians, where the chi goes in. The chi goes in, open up circulation. So when you get a block in the chi freeway, the energy freeway, you don't have the energy, you don't have circulation, so your capillaries are all closed. When you breathe in, there's no blood circulation, no red cell to pick up your oxygen. And that's why you breathe in oxygen, you breathe it out. You can breathe it twice as fast, twice as deep, but you never feel the oxygen go in. So what I did for you, I opened up the circulation with the injection, which opened up a lot better than acupuncture. 10 times, 50 times better than acupuncture. If I use acupuncture on you, if somebody uses acupuncture on you, you will hardly feel the difference.
yeah.
Okay?
Oh, yeah.
With my injection, you suddenly feel so much oxygen because so much more circulation will pick up the oxygen and dump it into the cell. That's why you feel it all the way down
Yeah.
and all the way here. So now you can exercise and you have stamina. Do you feel your energy change?
Yes, oh, definitely, compared to when I came, I just had trouble
You were-
even walking slow.
You were all
I
like
can't,
curled
you
up
know.
like this.
Yes.
But you know, you're right, because now that you're saying that, I remember that I did, before I came here,
Yeah.
I took several treatments with acupuncture, like once a week.
From somebody else.
In Laguna Niguel,
Yeah.
from somebody else,
Yeah.
close to where I lived,
Yeah.
and it didn't help me at all.
Yeah, didn't do anything,
Didn't help
right?
me.
Yeah, yeah.
And actually, those needles, they said they weren't gonna hurt, but they did, they bothered me.
Oh. Mhm. Well, if I do acupuncture on you, it still help. But the injection help more.
Yes,
Yeah.
yeah, because that treatment, whoever did it, it just didn't help me at all.
Yeah.
So I came here and
I would like
I'm
my
a whole different
daughter
person.
to come in
Yeah.
and.
Infertility, improve circulation to the uterus. Wherever is it, improve circulation and balance and the kind of energy. The different chi, heart chi, lung chi. Your kidney chi was blocked. Without the kidney chi to care of fear, you have a lot of anxiety. Your heart chi,
Uh-huh.
the chi that deal with love, joy, and laughter was blocked. That's why you're so depressed. And that's why you have all this chest pain.
Chest pain,
Without oxygen, without the circulation, you have chest pain, but you didn't feel good.
yeah.
See right now, the fact that your dog died, the fact that about all the different stress is still there. but you don't feel stressed. You don't feel depressed. You feel different.
Yeah, definitely, definitely.
That's how our treatment works.
I wish you